What happens when a nearly forgotten disease suddenly reemerges? In 1930, the United States faced a dramatic surge of whooping cough cases, impacting communities across the nation. As hospitals overflowed with afflicted children, panic settled in, catching many health officials off guard. Cities scrambled to implement vaccinations, often too late to quell the growing crisis. The epidemic not only terrified parents, but also spurred a movement towards better public health measures. This unforeseen outbreak served as a stark reminder of the importance of vaccinations, forever changing how society approached disease prevention. Are we ever truly safe from the past?